Low-carbohydrate beer has become increasingly popular with the frequent perception that it's a more healthy option, with some people believing that it contains less alcohol. Replacing regular mixes with low-joule mixes that contain artificial sweeteners is known to accelerate gastric emptying and increase peak blood alcohol concentrations. Faster gastric emptying is also known to be associated with increases in blood glucose, which has implications for patients with diabetes. The comparative effects of low-carb, full-strength and low-alcohol beers on gastric emptying have not been previously evaluated. The aim of our project, therefore, was to evaluate the effects of low-carb, full-strength and low-alcohol beers on gastric emptying, ethanol or alcohol absorption, glycaedmia and insulinaemia in health. We studied 8 healthy young participants, 4 males and 4 females, with a mean age of 20 years and normal BMI. Our subjects were studied on 3 separate occasions following an overnight fast, and gastric emptying was assessed for 3 hours following ingestion of 600 ml of either full-strength, low-carb or low-alcohol beers, and these were all radio-labelled with 20 megabecquerels of technetium calcium phytate in a randomised crossover design. Data were corrected for subject movement, radionuclide decay and gamma-ray attenuation, and gastric emptying curves were generated. Blood samples were taken from an indwelling intravenous cannula immediately before the desk drinks and at regular time intervals for measurement of plasma ethanol, blood glucose and plasma insulin. Areas under the curve for the 3 hours were calculated for all variables using the trapezoidal rule, and overall differences between the drinks were assessed by analysis of variance. Relationships between the variables were assessed with Pearson's correlations. If we now look at the results, we can see that there's no significant difference in gastric emptying of the 3 drinks, with the full-strength beer indicated by the dark blue, the low-alcohol beer in the grey, and the low-carb beer in the light blue. In contrast, and not surprisingly, plasma alcohol levels were lowest after the low-alcohol beer, with no significant difference between the full-strength and low-carb beers. There was also a relationship between the early rise in plasma alcohol and the rate of gastric emptying after the low alcohol beer, with trends for a relationship after the full strength and low carb beers, meaning the faster the gastric emptying, the greater the rise in plasma alcohol. Blood glucose levels were also greater for the low alcohol than low carb beer, with no overall difference between the low alcohol and full strength or low carb and full strength beers. Similarly, plasma insulin levels were also greatest after the low alcohol beer, with no overall difference between the low alcohol and low carb beers with the full strength beer. So in conclusion, in healthy young subjects, gastric emptying of full strength, low carb and low alcohol beers is comparable, and it's also a determinant of the plasma alcohol response. Thank you.